Assalamu alaikum. So while discussing sometime with the patients regarding the nature of our job as a doctor, are we the doctor of the medicine or the doctor of health? So if you look at the day-to-day practice, I often find we are more like the doctor of medicine, while we are very less a doctor of the health. So why is it important to differentiate it? We are more motivated writing, prescribing the medicines, and people are following the psychology of the doctor. They also think the relief in the form of medicine. So many of the diseases which are very much associated with our lifestyle, many of the chronic diseases, and their remedy or the treatment lies in the same culprit of deviation from the good lifestyle to the bad lifestyle. If we want to be healthy, so again we have to reverse from the deviated path or the bad lifestyle to the good lifestyle, then disease will be no more. But the people rely more on the medicine. They just want the shortcut, the easy way. Like today, I'm enjoying good health, and I start deviating from the right healthy pathway of the life, good lifestyle, and start consuming the things which are not considered good, oily things, sweet things, and more inclined towards the taste-oriented lifestyle in the form of the choice of my foods, which are not healthy one, but they are very much tasty, oily junk food, and started gaining the weight, then that is the first sign of the disease. Though I'm not established yet any disease name like diabetes, but else as we think health is just lifestyle. So from the time I'm deviated from that good lifestyle towards the bad lifestyle, then I have already invited disease, though that has not given the name in the medical dictionary, but that is actually the big disease when that is unknown form leading towards a set of the diseases, the form of metabolic diseases or metabolic syndrome, in which there is derangement first of the lipids, cholesterol, my triglyceride, my LDL, HDL, some derangement, that and the derangement of the blood sugar as well, and that actually started with the gaining of some of the weight in the form of fat. That increase in content of the fat in my body, which is not needed, but that is exerting its own effect in the form of stimulating more insulin, which is actually the reserve form of my body. But due to my that stimulus of taking enough calories and the sugars, ultimately body makes everything in the form of the sugar, and the sugar gets accumulated, then again it is converted into the fat. So this is the cycle keeps on going in the body. So what happens? That leads to some disease, if not named today, but tomorrow I would be diagnosed with some sort of disease like metabolic syndrome that ultimately goes to ischemic heart disease, that or to take an MI, then the further in the form of some retinopathy in my eyes, some gastropathy, some fatty liver disease, some nephropathy. So these are the names, but that have already been triggered, invited through my lifestyle. So many of the chronic diseases are very much linked with the lifestyle. They may not be given name at today, but tomorrow they would be given name. So that is very much linked with that. My way of eating behavior and not consuming in the form of physical activity, then that is multiplied. If I am stressful, my lifestyle stress, that is speed up towards the disease if I am stressed, and that is even multiplied more if lack of sleep and some sort of negative attitude towards life. So the thought process, not healthy thoughts. So all of these things are actually the disease. So this attitude is actually the disease. The bigger name we can give it is the combination of all the diseases. So hope I could convey this message to you. Thank you very much and take care. Assalamu alaikum.